As people age past 70, the heart no longer functions as flexibly as it did when they were younger. The heart ages along with the entire circulatory system. The walls of the blood vessels become stiff, the capillaries lose elasticity, and the heart muscle weakens significantly. The amount of blood pumped out of the heart with each beat may gradually decrease, especially during exertion. This is a natural physiological aging process, but when combined with risk factors such as high blood pressure, high cholesterol, or diabetes, the risk of cardiovascular disease increases dramatically. A study by the National Institute on Aging in the United States found that after age 70, the heart's ability to respond to stress, such as climbing stairs or being emotional, decreases by 30 to 40%. This mechanism is called decreased cardiac reserve. That means that even everyday activities can make older people feel tired, short of breath, or dizzy. Common heart diseases in the elderly. Hypertension, silent killer. Hypertension is the most common disease in the elderly. According to statistics from the Vietnamese Ministry of Health, up to 60% of people aged 70 and over have this disease. High blood pressure increases pressure on the blood vessel walls, making the heart work harder, causing left ventricular hypertrophy in the long run, leading to heart failure. In addition, high blood pressure does not cause obvious symptoms, so many people do not know they have the disease. A 75-year-old patient in Hanoi shared, "I thought dizziness was due to old age, but when I went to the doctor, I found out that my blood pressure was 180/100 mmHg." Heart failure. Heart failure is a long-term consequence of many cardiovascular diseases, including high blood pressure, coronary artery disease, and heart valve damage. For the elderly, heart failure often manifests silently as fatigue, decreased ability to exercise, swollen legs, or shortness of breath when lying down. There are two main types: systolic heart failure, the heart does not pump blood effectively, and diastolic heart failure, the heart does not relax well enough to fill with blood. A 2022 study at the University of California, Los Angeles School of Medicine found that 40% of patients hospitalized for heart failure were over 70 years old, and the rate of readmission within 6 months was as high as 50%. Coronary artery disease. Coronary artery disease occurs when the arteries supplying blood to the heart muscle become narrowed, reducing blood flow, causing myocardial ischemia. Older people may not have typical chest pain symptoms, but only feel a little tired, heavy chest, or full stomach. Angina in older people is often overlooked or misdiagnosed as a stomach problem. This is extremely dangerous because it can lead to a heart attack. Arrhythmia. Irregular heartbeats, especially atrial fibrillation, are common in people over 75. Atrial fibrillation reduces the heart's pumping efficiency and increases the risk of blood clots, which can easily cause stroke. Many people discover atrial fibrillation only after having a stroke. Risk factors for heart disease in the elderly. Age, a factor that cannot be changed. Age is the most important risk factor for cardiovascular disease. According to the World Health Organization, WHO, the risk of cardiovascular disease increases 2 to 3 times every decade after the age of 60. The accumulation of microfactors such as smoldering inflammation, oxidative stress, and endothelial damage over time makes the cardiovascular system much more vulnerable. In people aged 70 and older, the risk of serious complications, such as heart failure or stroke, due to heart disease is also 3 to 4 times higher than in the 50 to 60 age group. Chronic hypertension. As mentioned above, high blood pressure makes the heart work continuously under great pressure. Over time, this causes damage to the heart muscle, left ventricular thickening, and reduced contractility. The famous American Framingham study has proven that if blood pressure is not well controlled after the age of 65, the risk of heart failure increases by 2.5 times. In Vietnam, many elderly people have the habit of buying medicine themselves or stopping medicine when they feel healthy again, leading to unstable blood pressure, a silent dangerous factor. Diabetes and metabolic disorders. Type 2 diabetes and dyslipidemia, high cholesterol, high triglycerides, often accompany old age. These diseases increase atherosclerosis, which is the main cause of coronary artery stenosis and stroke. An elderly person with a blood sugar index greater than 7.0 millimoles per liter and LDL cholesterol greater than 3.0 millimoles per liter will have a risk of myocardial infarction 3 times higher than normal people, according to a report by the European Society of Cardiology, ESC. Sedentary lifestyle. Older people tend to move less, especially if they have joint problems or have had a fall. Sitting or lying down for long periods of time reduces blood circulation, increases weight, reduces muscle mass and increases visceral fat, all of which contribute to poor cardiovascular health. Light physical activity, such as walking for 30 minutes a day, can reduce the risk of cardiovascular disease by up to 20%, according to a study published in the journal Circulation, USA, 2021. Medications and concomitant diseases. Older people often take many medications at the same time, polypharmacy. Some medications can cause cardiovascular side effects such as fluid retention, causing edema, electrolyte disturbances, causing arrhythmia, or drug interactions that increase blood pressure. In addition, chronic diseases such as chronic kidney disease, COPD, chronic obstructive pulmonary disease, or chronic anemia also affect the heart through indirect mechanisms. Detecting and treating heart disease in the elderly. Challenges in diagnosing heart disease in the elderly. Diagnosing heart disease in the elderly is not simple because the symptoms are often vague, atypical, or confused with normal signs of aging. Some common examples. Chest pain can be mistaken for stomach pain or muscle pain. Shortness of breath is considered old age weakness. Fatigue or leg swelling is considered anemia. Therefore, regular checkups and careful medical history are extremely important. The doctor needs to ask carefully about the patient's history of high blood pressure, diabetes, lifestyle habits, current medications, and daily activity level. Modern diagnostic methods. Some necessary and effective tests in early detection of heart disease in the elderly include: electrocardiogram, ECG, helps detect arrhythmias, old myocardial infarction, or myocardial ischemia. Echocardiogram assesses the size of the heart chambers, contractility, and condition of the heart valves. Blood tests check cholesterol, blood sugar, cardiac enzymes, troponin, and BNP hormone, heart failure marker. CT coronary angiography or percutaneous coronary angiography, used when severe coronary artery disease is suspected. For the elderly, techniques need to be performed gently, quickly, and with psychological support because many people are easily worried and afraid when going to the hospital. Principles of heart disease treatment for people over 70 years old. Individualized treatment. There is no general regimen for all elderly people. Each patient needs to be considered. Overall condition: kidney failure? Can you still walk? Biological age instead of just real age. Ability to comply with treatment, medication, lifestyle. Risk of drug interactions and side effects. Drug treatment, cautious and accurate. Some groups of drugs commonly used in heart disease. Antihypertensive drugs, ACE inhibitors, enalapril, beta blockers, bisoprolol, calcium channel blockers. Diuretics, used when there is edema or congestive heart failure. Anticoagulants, used in atrial fibrillation or coronary stents. Lipid-lowering drugs, statins such as atorvastatin or rosuvastatin. However, the elderly are susceptible to postural hypotension, dizziness, or electrolyte disturbances if taking high doses. Therefore, it is necessary to start with a low dose and monitor closely. Intervention and surgery, careful consideration. Coronary stenting is still performed in the elderly if they are independent and have good recovery ability. Transcutaneous cardiac valve replacement, TAVI, is an option for patients over 75 years old with aortic valve stenosis but cannot tolerate open surgery. Pacemaker is placed when there is a slow arrhythmia causing fainting or prolonged fatigue. Doctors need to coordinate with family members and assess the ability to live independently, self-care, expected life expectancy, before deciding on major intervention. Long-term monitoring and cardiac rehabilitation. After acute treatment, elderly patients need to Monitor blood pressure and heart rate periodically at home or at the medical station. Regular checkups and regular tests, cholesterol, ECG. Participate in cardiac rehabilitation, including guided exercise, healthy diet, and psychological support. Cardiac rehabilitation is especially important after a heart attack or acute heart failure, helping to improve quality of life and reduce the risk of rehospitalization. Practical advice and real-life stories. Tips to keep your heart healthy after 70. Measure your blood pressure at home at least twice a week. Blood pressure should be stable below 140/90 mmHg. Measure at rest, avoid immediately after eating or exercising. If there is any abnormality, record it and report it to your doctor. Eat a low-salt diet, reduce animal fat, increase green vegetables and fatty fish. Limit salt to less than 5 g/day. Use vegetable oil instead of lard. Increase foods containing omega-3 such as salmon, mackerel, walnuts. Get some light exercise every day. Just take a 20 to 30 minute walk, do some deep breathing exercises, or do some yoga. Regular exercise helps keep your heart healthy, helps control your weight, and improves your blood pressure. Get enough sleep and keep a stable mood. Prolonged insomnia and stress can cause heart rhythm disturbances. Meditation, reading, or chatting with friends will benefit cardiovascular health. Regular checkups and taking medication as prescribed. Do not stop taking medication when you feel better. Elderly people need to follow medical orders and immediately notify the doctor if there are unusual signs such as chest pain, shortness of breath, or leg swelling. Limit alcohol, absolutely do not smoke. Alcohol and nicotine cause vasoconstriction, increased blood pressure and the risk of arrhythmia. Many elderly people have strokes after having a few drinks during the holidays. Regular social interaction, avoid loneliness. A positive mood and rich spiritual life help the heart beat more regularly and strongly. You can join a senior club, participate in community activities, or keep in touch with your children and grandchildren. Falls and injuries in the elderly. Falls, a serious but often overlooked problem. Falling in the elderly is not simply a normal fall. For people over 70, a fall can be the beginning of a chain of health decline, leading to broken bones, loss of self-care ability, and even death. According to the World Health Organization, WHO, falls are the leading cause of death from unintentional injuries in the elderly worldwide. In Vietnam, according to statistics from the Ministry of Health in 2022, about 30 to 40% of people over 70 years old have fallen at least once a year. Of these, nearly 20% lead to serious injuries, most commonly femoral neck fractures and traumatic brain injuries. The mortality rate within 1 year after a femoral neck fracture in people over 80 years old can be up to 20 to 30%. Common causes of falls in the elderly. Physiological factors due to aging. Impaired vision and hearing, blurred vision, poor hearing make it difficult for the elderly to observe obstacles, making it easy to trip and fall. Loss of balance, due to aging of the vestibular system and deep sensory nerves. Muscle weakness, decreased muscle mass, sarcopenia reduces the body's ability to support itself. Osteoporosis, does not cause falls but makes the consequences of falls more serious. Chronic diseases affecting balance. Cerebrovascular accident, previous causes hemiplegia, muscle weakness, unsafe movement. Parkinson's, causes tremors, slow walking, stiffness. Hypoglycemia, postural hypotension, due to diabetes or drugs that cause sudden dizziness. Dementia, disoriented walking, easy to bump into objects. Medications and treatments. Some cardiovascular, neurological, or sedative drugs cause dizziness, drowsiness, and impaired consciousness. Older adults often take multiple medications, polypharmacy, which increases the risk of adverse interactions that can lead to falls. Inappropriate living environment. Slippery floors, steep stairs, bathrooms without handrails. Lack of lighting, especially at night. Improper or slippery footwear. Consequences of falls, more than just bruises. Falls can have serious and long-term consequences. Fractures, especially femoral neck. This is the most serious type of fracture in older adults. More than 80% of people with femoral neck fractures after age 75 need hip replacement surgery, and most are unable to walk as before. According to research at the Los Angeles Orthopedic Hospital, 2021, the one-year mortality rate due to complications after femoral neck fractures is up to 28% in people over 80 years old. Spinal fractures are also common but are easily overlooked because the pain is dull and unclear. Loss of self-care. An elderly person who previously went to the toilet and ate independently may become completely dependent on relatives after a fall. This leads to malnutrition, due to eating little or no food. Pressure ulcers, if lying down for a long time and not being properly cared for. Depression and mental breakdown, loss of confidence, fear of falling again. Costs and burdens on families. Treatment of a femur fracture is often lengthy, and can cost between 40 and 70 million VND for surgery and subsequent rehabilitation. Without adequate insurance or medical support, the financial burden falls on relatives, both in terms of money and time spent on care. Fall prevention in the elderly, practical strategies at home and in the community. Fall prevention does not require high technology or high costs, but the most important thing is the awareness and timely action of the family, caregivers, and the elderly themselves. Regular fall risk assessment. Older adults should be screened for fall risk at least 1 to 2 times/year at medical facilities or by their family doctor. Some simple tests. Stand up, walk 3 meters, turn around test, taking more than 12 seconds is high risk. Stand up, lie down blood pressure measurement, to detect postural hypotension. Evaluate vision, hearing, gait, balance. Enhance muscle, bone, balance strength. Maintaining appropriate physical fitness significantly reduces the risk of falls. Appropriate forms of exercise. Daily walking, 15 to 30 minutes, on flat ground. Exercises such as yoga, light tai chi or tai chi have been shown to significantly improve balance. Leg exercises in place, standing behind a chair, lifting the heel and toes alternately, 10 to 20 times/day. One-legged standing, light handrail improves balance. Research by the U.S. National Institute on Aging shows that exercising regularly 3 to 4 times/week can reduce the risk of falls in people over 75 by up to 40%. Proper nutrition and supplementation. To prevent falls and fractures, ensure calcium 1,1200 mg/day from milk, small seafood, green vegetables. Vitamin D 800 to 1000 IU/day from sunlight and supplement if lacking. Adequate protein, at least 1 g protein/kg body weight/day, from eggs, fish, tofu, lean meat. Elderly people with poor appetite need to have their weight monitored regularly and be supported by a nutritionist if necessary. Limit drugs that cause dizziness and drowsiness. Doctors need to regularly review prescriptions for the elderly. Limit the use of sedatives and sleeping pills if not really necessary. Adjust blood pressure and diabetes medications to avoid excessive drops that cause dizziness. Reduce the number of unnecessary medications, reduce polypharmacy. Education and psychology of the elderly. Part of the reason why the elderly are prone to falls is because they are afraid of being constrained, do not want to use a cane or hold onto handrails because they are embarrassed, or do not realize that they are weak. They need to be gently educated and encouraged to self-assess their health. Introduce modern, aesthetic support tools that are easy for them to accept, such as smart canes, stylish anti-slip sandals. 7 practical tips to prevent falls at home. Install a Sensodyne light or keep it dim at night. The light automatically turns on when someone walks around at night, avoiding tripping. Do not leave slippers, rugs, or obstacles on the floor. The house must be neat and easy to observe, especially the path from the bed to the bathroom. Do light exercise every day. The elderly should keep their muscles and bones strong by walking, doing chair exercises, and yoga. Review your eyes and ears once a year. Wear glasses with the right prescription, use hearing aids if needed. Regularly review your medications. especially sleeping pills, blood pressure medications, or diuretics. Eat enough calcium, vitamin D, and protein. Avoid silent osteoporosis, the culprit that makes bones more likely to break when falling. Equip support tools and don't be afraid to use them. Walking sticks, handrails, and non-slip slippers are not a sign of weakness, but rather a sign of intelligence to live independently longer. Respiratory diseases, the silent enemy of old age. Why are the elderly susceptible to respiratory diseases? As we age, the human respiratory system becomes weaker, no longer able to clean and protect itself as well as when we were young. The small hairs in the lungs, which are responsible for sweeping away dust and bacteria, slow down. The respiratory tract lining becomes drier and less elastic. The respiratory muscles also weaken, making it more difficult to cough up phlegm. All of these factors make the elderly, especially after 70, susceptible to respiratory infections, and susceptible to chronic diseases such as COPD, pneumonia, or asthma in the elderly. Another cause is age-related immune decline. After the age of 70, the body no longer produces immune cells effectively, reducing the ability to respond to bacteria and respiratory viruses, typically influenza, RSV, and pneumococcal viruses. Common respiratory diseases in people over 70 years old. Chronic obstructive pulmonary disease, COPD. COPD is an incurable disease, often caused by prolonged smoking or exposure to dust, air pollution. Typical symptoms are prolonged cough with phlegm, shortness of breath when exerting, fatigue. I thought I only had a winter cough, but the doctor said it was obstructive pulmonary disease, Mr. Caleb, 74 years old. COPD treatment requires a combination of medication, bronchodilators, inhaled corticosteroids, respiratory rehabilitation exercises and avoiding risk factors, cigarette smoke, cold air, etc. Pneumonia in the elderly. Pneumonia is the leading cause of hospitalization in people over 70 years old. Symptoms are often not as obvious as in younger people, sometimes no fever, no cough, just feeling tired, loss of appetite, mild confusion. My grandmother only said she was tired and lethargic, but by the time she was hospitalized, she had severe hypoxia, the granddaughter of Victoria, 83 years old. Therefore, caregivers need to pay attention to faint but dangerous signs, especially after a cold or sudden cold. Asthma in the elderly. Many people mistakenly think that asthma only occurs in children, but in fact, late-onset bronchial asthma is a common condition. Because the symptoms are similar to COPD, cough, shortness of breath, wheezing, it is easy to miss. Asthma in the elderly can cause shortness of breath at night, which needs to be diagnosed by measuring respiratory function and treated with regular inhalers. Pulmonary fibrosis. Another chronic disease is idiopathic pulmonary fibrosis, which causes lung tissue to thicken and stiffen, making the patient feel a lack of oxygen and increasing shortness of breath. The disease progresses slowly but has a serious impact on quality of life. Early detection and prevention, the key to a healthy life. Small but worrying signs. Coughing lasting more than 3 weeks without fever. Shortness of breath when climbing stairs or walking normally. Frequent fatigue, unexplained weight loss. Feeling out of breath when talking a lot. Effective respiratory disease prevention. Regular vaccination, flu, pneumococcus, RSV, these are viruses that cause severe pneumonia. Practice deep breathing, exhale for a long time 2 to 3 times a day. Gentle exercise, walking, yoga, qigong, tai chi. Do not smoke, avoid polluted environments. Warm and humidify the bedroom in winter. Connecting breath and spirit. Breathing is not only life, but also peace. For the elderly, breathing also has spiritual value. A person who knows how to breathe correctly will keep the mind alert, relaxed and fight against anxiety and insomnia, factors that also negatively affect breathing. After 10 minutes of breathing meditation every morning, I feel calmer and have fewer shortness of breath attacks. Eleanor, 77 years old. Respiratory diseases are silent enemies that the elderly need to be aware of. With the right knowledge, good habits and support from relatives, the elderly can breathe lightly, live deeply, and live long. Stroke, the fatal moment. What is a stroke? A stroke is a medical emergency that occurs when blood cannot flow to the brain. When the brain does not receive enough oxygen and nutrients for a few minutes, brain cells begin to die. Every minute that passes, nearly 2 million brain cells are damaged beyond repair. There are two common types of stroke. Ischemic stroke, accounting for 87% of blood clot, blocks a blood vessel in the brain. Hemorrhagic stroke, a blood vessel ruptures, causing bleeding in the brain. In people over 70 years old, stroke is the leading cause of death and the most common cause of permanent disability if not treated promptly. Who is susceptible to stroke? After age 70, the risk of stroke increases 2 to 3 times every decade. Here are the factors that increase the risk. High blood pressure, the number one risk factor. Arrhythmia, atrial fibrillation, causes blood clots to form. Type 2 diabetes, damages small blood vessels in the brain. Obesity, lack of exercise, smoking, lipid disorders. History of mini stroke, TIA, an early warning but often overlooked. I had a slight dizziness once but subjectively thought the next time was a real stroke, Mr. Samuel, 79 years old. Warning signs, remember the FAST principle. When it comes to stroke, time is of the essence. The earlier it is detected, the higher the chance of survival and recovery. Remember the FAST rule. Letter meaning sign. F face crooked mouth, uneven smile. A arms weak, paralyzed one arm. S speech difficulty speaking, unusual slurred speech. T time call 911 immediately. Absolutely do not self-treat at home or let yourself sleep to recover. True story, 5 minutes decide 5 years of life. Mrs. Charlotte, 74 years old, lives with her husband in a small town in Texas. One morning, she was making tea when suddenly her left hand dropped the kettle, her mouth twisted to one side. Her husband noticed the strange sign and called 911 immediately. 30 minutes later, she was given thrombolytic therapy, TPA, a drug that only works if used within the first 3 hours after a stroke. After 2 weeks of treatment, Miss Charlotte recovered almost completely. She returned to normal activities, only needing physical therapy for her left hand for 2 more months. I thank God that my husband did not hesitate. Just a little hesitation and I could not talk to my grandson today, Mrs. Charlotte shared. Stroke prevention, live proactively, live healthy. Stroke prevention is not difficult if you understand yourself and actively monitor your health. Control blood pressure, target below 130/80 mmHg. Take medication regularly if you have cardiovascular disease, diabetes. Exercise 30 minutes a day, walk, cycle, yoga. Reduce salty food, quit smoking, limit alcohol. Regular checkups, pulse, blood pressure, blood lipids, electrocardiogram. Stroke recovery, journey from darkness to light. Not everyone recovers like Mrs. Charlotte. Many stroke survivors face hemiplegia, difficulty swallowing, difficulty speaking, speech disorders, depression, loss of confidence. However, with rehabilitation therapy, patients can completely eat, walk, and talk again if they have a persistent companion. After a stroke, my father had to learn to write from scratch, like a child. But the day he wrote his name, the whole family cried with happiness. Henry's daughter, 85. A stroke is a sudden storm, but it is not the end. With the right knowledge, quick response, and proactive lifestyle, you can reduce your risk, live safely, and make a miraculous recovery. Brain, preserving last memory. When the brain ages, what really happens? By the age of 70, your brain has gone through more than 2.5 billion bioelectrical pulses, processing millions of memories, sadness, joy, trauma, and recovery. But over time, nerve cells gradually decrease, neurotransmitters such as dopamine, acetylcholine decrease, causing the ability to remember, think, and process information to slow down. Brain aging does not mean complete memory loss, but is a silent process, starting with Forgetting recent events. Calling a loved one by the wrong name. Being confused when doing familiar tasks. Losing orientation in familiar spaces. I was talking and then forgot what I was going to say. It felt like my brain stopped for a few seconds. Mr. Benjamin, 72 years old. Dementia, a disease that eats away at your personality. Unlike temporary forgetfulness, dementia is a progressive decline in brain function, affecting memory, language, judgment, and self-care. Common types of dementia. Alzheimer's accounts for 60 to 70%, causing progressive memory loss. Vascular dementia, a consequence of many small strokes. Lewy body dementia, often accompanied by hallucinations, Parkinson's-like tremors. Frontotemporal dementia, loss of emotional control, strange behavior. Warning signs. Forgetting the names of loved ones, getting lost in familiar places. Repeating questions, telling a story many times without remembering. Personality changes, suspicious, impulsive, easily angered. Uncontrollable behavior, spending money irrationally, lack of personal hygiene. My mother, who used to be a teacher, now doesn't recognize her daughter and calls the TV a magic window. Shared by Zoe, 49 years old. Depression, the hidden enemy of the brain. Depression in the elderly is easily overlooked because it is often mistaken for old age temperament. However, it is a chemical disorder of the brain, deeply affecting sleep, memory, emotions, and immunity. Symptoms of depression in the elderly. Prolonged sadness, loss of interest in everything. Sleep and eating disorders. Complaining about pain without finding the cause. Thoughts of wanting to die or to disappear to avoid bothering children and grandchildren. Depression is not weakness, but a disease that needs to be treated with psychotherapy, appropriate antidepressants, and, most importantly, unconditional love from family. How to keep your mind sharp after 70. There is no magic pill to prevent brain aging, but there is a golden strategy of 5C to keep your brain healthy every day. Milestone action. 1. Movement, regular exercise, walking, aerobics, qigong. 2. Nutrients, omega-3, vitamin B12, green vegetables, limit sugar and saturated fat. 3. Active learning, learn something new every week, like playing an instrument, writing poetry, learning a new language. 4. Positive emotions, meditate, practice breathing, keep your mind relaxed, avoid chronic stress. 5. Community, communicate, join a group of old friends, tell stories to your grandchildren. My dad is 80 years old, writes a diary every day, plays Sudoku, and learns Spanish through an app. He has never mistaken anyone's name in the family. Ryan, 50 years old. When you keep your mind sharp, you keep yourself. The brain is the root of personality, the repository of memories, emotions, and values. Keeping the brain healthy is not just about preventing disease, it is about keeping the flame of humanity alive in every last breath of life. Balance between medicine, food, and physical. After 70, the body no longer processes as before. In middle age, our bodies are able to metabolize drugs, absorb nutrients, and recover from exercise quite well. But after 70, the functions of the liver, kidneys, intestines, and muscles all decrease significantly, requiring more delicate adjustments in the use of drugs, diet, and exercise. In the past, I took painkillers and felt better immediately. Now, just a little bit of the wrong dose can cause fatigue, dizziness, or stomach pain. Mr. Lucas, 75. Medications, both a savior and a double-edged sword. Elderly people often have to take 3 to 8 types of medication every day, the most common of which are blood pressure medication, diabetes medication, anticoagulants, arthritis pain medication, sedatives or sleeping pills. However, side effects and drug interactions are potential dangers. Diuretics can cause potassium loss, muscle weakness, heart rhythm disturbances. Antidepressants can cause confusion, falls due to postural hypotension. Sleeping pills cause dependence or daytime confusion. Safety advice. Do not take medication on your own based on experience or acquaintances' advice. Regular checkups to adjust dosage. Keep a record of dosage and time of taking to avoid forgetting or taking the wrong medication. Stop taking medication properly, gradually reduce, do not stop suddenly with cardiovascular and neurological medications. Food, tonic or toxin. Common misconceptions. I eat less so it's okay. Wrong, because the elderly need the right nutrients, not just less. The more nutritious the better. Wrong, because overnutrition, protein, calcium, vitamins, is also harmful. Ideal nutrition for people over 70. Suggested nutrients. Protein: salmon, eggs, tofu, chicken breast, 70-100 g/day. Calcium: low-fat milk, yogurt, spinach, 800 to 1200 mg/day. Omega-3 fish, walnuts, flaxseed oil, good for the heart and brain. Fiber: oats, green vegetables, beans, prevent constipation and diabetes. Vitamin D: early sunlight, supplements if lacking. Avoid refined sugar, cakes, soft drinks. Saturated fat, fatty meat, fried a lot. Processed foods, high in salt. I quit drinking soft drinks at the age of 74. Now my blood pressure is stable, my liver and kidneys are much lighter. Amelia, 78 years old. Exercise, the key to activating both drugs and food. Research has shown that regular exercise helps increase drug absorption, stabilize blood pressure and stimulate digestion. Suitable forms of exercise. Walking 30 minutes/day reduces the risk of premature death by 40%. Qigong or Tai Chi helps maintain balance, avoid falls. Yoga for the elderly increases flexibility, reduces joint pain. Light weight training or using elastic bands maintains muscle mass, prevents osteoporosis. Important, don't wait until you're healthy before exercising, exercise to get stronger little by little. You can start with just 5 minutes of walking around the house, then gradually increase. Smart coordination, 3T formula, medicine, food, physical. To live well after 70, you need to skillfully combine 3 factors. Right medicine, right dose, right time. Eat enough, not too much, but selectively. Exercise regularly, not too hard, but maintain at least 5 days per week. I call it the healthy living triangle. If you deviate from one peak, you will see your body decline immediately. Mr. Nathan, 80 years old. Old age is not just about living long, it is about living proactively. You cannot avoid medicine, cannot eat and drink haphazardly, and cannot sit in one place forever. When medicine, food, exercise are coordinated harmoniously, that is the formula for a lasting, peaceful, and meaningful life in old age. Quality of life and happiness in old age, meaningful life, not just long life. Old age, surplus time or golden time? Many people think that after 70 years old is the time to wait, the stage of no longer having a role in society, just staying healthy is enough. But psychological and behavioral medicine studies have proven, old people with high quality of life live 5 to 7 years longer than people of the same age who live isolated, bored, and no longer feel valuable. Quality of life equals healthy body plus good spirit plus positive relationships plus purpose in life. I don't count the years I'm alive, I count the things I do that make others smile. Arya, 81 years old. Destroyers of the elderly's quality of life. 1. Loneliness and social isolation. According to statistics, loneliness increases the risk of premature death equivalent to smoking 15 cigarettes/day. No one should grow old alone. Social isolation leads to depression, dementia, and loss of meaning in life. 2. Loss of purpose in life. When they no longer work or raise children, many elderly people feel just a burden. This makes them give up, take less care of themselves, are afraid to go out, quit smoking, and eat carelessly. 3. Loss of self-worth. Many elderly people used to be engineers, teachers, doctors, but after retirement, they feel useless, especially when their children and grandchildren rarely talk to them. asked for their opinions or looked down on their views. How to feel happy at 70, 80 and beyond. Rejuvenate your sense of usefulness. Play a role in the family, babysitting, sharing parenting experiences, teaching children to cook. Advise the community, volunteer, teach life skills, tell stories. Share wisdom through writing, painting, poetry, writing memoirs. Create social connections. Join a seniors club. Exchange through technology, learn to use the phone, video calls, social media. Meet old friends regularly, Saturday coffee, Sunday lunch. Take care of your spirit like you take care of your body. Meditation, reading, drawing, planting trees, raising pets, simple healing therapies. Create a habit of writing down positive things every day, gratitude journal. Take the initiative to see a mental health professional if you have signs of depression. Every morning I write down 3 things that make me feel grateful. That makes me feel lighthearted. I don't have to wait for anyone to make me happy anymore. Mr. Dillon, 84 years old. Relationships with children and grandchildren, the valuable art of stepping back. Many elderly people feel hurt because their children forget them, or vice versa, feel they have lost their freedom when living together, are financially dependent, and are overly controlled. To maintain harmony and joy in the family, the elderly should share but do not interfere, listen, give advice, but do not force. Be financially independent to the extent possible, to still feel independent. Know how to let go at the right time. Children and grandchildren can go their own way, and that does not mean they do not love you. Happiness in old age does not lie in the amount of money saved, does not lie in the long days passing quietly. It lies in who you are still connected to, who still needs you, and whether you still feel worth living every morning when you wake up. When you ask yourself, what am I living for? And there is a big enough answer. You have found true quality of life.